is your feel-good breakfast show right here, Expresso on S3, and it is a Health Tuesday, which means that we're going to give you the good stuff. Help is on the way, all right? Because anemia during pregnancy is a silent but very serious health concern that, listen to this, affects millions of women worldwide. In fact, 2 out of 3 South African expectant mothers are at risk. Now, left untreated, it can lead to severe complications for both mother and baby itself. Now, today we're joined by inflammatory bowel disease nurse specialist Dr Karin Daviosion to unpack the impact of maternal anemia and also how it can be prevented and what sort of steps expecting mothers should take to safeguard their health and that of their children, most importantly. Sister, welcome. Thank you so much for being here.
Thank you very much for having me.
A topic that's not often discussed, so it's necessary on this Health Tuesday to get into it. As you said before, even in the break, that it's often an overlooked issue, not something that people even know to bring up when it comes to checking in with their doctors. So what are the most common causes of anemia in pregnancy? How does that sort of work?
Okay, so anemia is basically caused by iron deficiency. And iron deficiency is when your iron stores or your iron pantry is running a bit low. And you don't have enough iron to meet your body's requirements.
Right.
And so iron is used to make your red blood cells in your body, which then carry your oxygen around your body. So if you're iron deficient, you can become anemic. So anemia is the end stage of iron deficiency. Now, what happens in pregnancy is that your iron demand increases more than it would be normally. So not only are you trying to meet your own iron needs, you need iron to grow the placenta and you need iron to grow your baby.
Right.
And the problem is a lot of women, up to 40% of women, enter pregnancy already iron deficient. So they've depleted over years through heavy menstrual bleeding, through rapid growth, through poor diet. And so they go into pregnancy iron deficient, and then they have this massive increase in demand.
Sheesh. Okay. Early warning signs. Let's talk about that, because often we meet it at the end where the symptoms are very apparent, but maybe there are ways that we can tackle this beforehand.
Absolutely.
What do we look out for?
So it's important to remember that iron deficiency and anemia have the same symptoms.
Okay.
You don't have to be anemic to have the same symptoms. So often we want to catch things when you're iron deficient and not anemic. So things that we often write off as normal life. So fatigue, poor sleep, brain fog or poor mental concentration, what we call poor effort tolerance, so your inability to get to an end of a day without feeling like you've got to get on the couch and have a sleep.
Sure.
And so those are very early signs. One of the big things as well are what we often call pregnancy cravings. So where you're craving weird substances. Now, that has a medical term called pica, but it is a very classic symptom of iron deficiency and anemia.
Wait, what is weird, sister?
Okay, so now we got to talk weird. So eating copious amounts of ice, chalk, soil, paper, very different things. So mostly non-food substances, but also very strange combinations of food. So people will say, I want to eat sardines and pineapple together. So these things are often indicative of iron deficiency and anemia.
Wow.
So really, I think bear in mind, fatigue is not normal. Pregnancy brain fog is not normal. Eating copious amounts of ice is not normal.
Right.
So really those are your
some of the
signs.
early signs you can look at. Well, I mean, speaking about diet, maybe we can touch on this for a second, because are there ways that we can supplement or support ourselves when it comes to our diet to make sure that maybe we can avoid all of this that you speak of?
100%. So I think it's very important to recognize that diet is great for maintaining iron levels, but it's very difficult to bring low iron levels up with diet alone.
Okay.
And when we look at diet, we look at iron-rich foods. So we look at things that are high in iron. So our meats, like our red meats, our chicken, our fish, that kind of thing. And then our non-heme irons, which are all our leafy green veggies, our legumes, our nuts, those kind of things. So those are all really great iron-rich foods. But if you can combine them with the vitamin C containing food, your absorption of those foods is much better.
Right, your oranges.
Yeah, your oranges, your red peppers combined with one of your meats makes a big difference. And then also to make sure your B12 levels are good, because that also helps absorb or helps your body to absorb iron from your intestinal tract. So it really makes a big difference.
Okay, cool. I'm glad that help is on the way. I mean, I'm sure many women right now are feeling more at ease. Perhaps if they've got a little bit too far, please tell me that there are treatments available that could perhaps help women in these situations. Is there anything else if diet doesn't help, or maybe, yeah, just to support that?
Absolutely. So definitely, just because you're iron deficient doesn't mean you've got to stay that way.
Okay.
So oral iron is always first prize. So the most important thing is to check that you are iron deficient. So don't just go on your symptoms and go and take iron. You need to check your levels first, because oral iron is a treatment. So you need to make sure that you're treating something that is deficient and not just taking it because you think you may be.
Right.
So oral iron, definitely, and make sure that you take it correctly, so that you're taking it no tea, no coffee, no cereals, no dairy an hour before or after your oral iron.
Sure.
And that you take it again with vitamin C. And then you only take oral iron for 6 weeks, and then you recheck. If you haven't had a response within that 6 weeks, you need to switch to an IV iron formulation. So don't keep taking oral iron for months on end,
right,
years on end, thinking it's going to help.
Yeah.
If you're not responding, and particularly in pregnancy where time is short. 6 weeks of oral iron, no response, switch to IV iron, because you've got to correct it during pregnancy in particular.
Oh, I love that. Sister Karin is still here. Part 2 is coming your way. We've spoken all about anemia when it comes to pregnant women. What about the babies? Well, we'll touch on that in just a little bit. So your Feel Good Breakfast Show. And we're also back with Karin Daviosion, Sister Karin Daviosion at that, diving deeper into the impact of maternal anemia on newborns in particular. Now, with research showing that babies born to anemic mothers can take years to catch up developmentally, it's clear that iron levels during pregnancy play a crucial role in shaping a child's future health. So let's get into this, because it's vitally important. We're not just taking care of our bodies, but the bodies that we're creating, essentially. So let's get into talking about not only affecting the mother, but the children too. The long-term effects, what are some of the risks on the newborn babies? Can we get into that?
Yeah, absolutely. So I think iron is critical to baby's neural development and physical development in utero. So the baby needs iron right from the get-go in terms of development. Now, when we look at babies whose mums are iron deficient and or anemic, they often have what we call intrauterine growth retardation. So they're smaller than they should be for their gestational age.
Sure.
So these babies are often born low weight. They're born premature, so they're at risk of premature delivery. They have a much higher ICU admission rate post-delivery. They have much higher risk of infections in their first part of their lives. They're poor feeders, they're poor sleepers, and they also bond poorly with their mother. Yeah. So, you know, those are kind of very early on. And then you look at your little infant or kind of baby who's growing, and they reach their milestones both cognitively and physically later than children who are born to mothers who are not iron deficient. So early on in children's development, this has a huge impact on their ability to learn and grow and absorb and process information cognitively.
Sure. And is this something that if moms don't pick it up early enough and they see it with their children, they only pick it up at a later stage with them?
Yeah.
Oh my goodness, pediatricians would notice this.
100%.
Okay. Oh, I don't want to say it's scary, but some of these things are things that we have to consider, even probably before falling pregnant. I mean, early detection is definitely key to avoid these complications. So I wonder how often pregnant women should maybe get their iron levels checked, or women in general, maybe. Because before falling pregnant, maybe it's important to even know where you're at.
Absolutely, and I think that's key. So if you're planning a pregnancy, check your levels before you fall pregnant.
Yeah.
And not just a hemoglobin. Please check your full iron studies, because if you only check a hemoglobin, you're going to miss iron deficiency. And iron deficiency is so much more easily correctable than anemia. So we always say if you're planning a pregnancy, check those levels first, but also check them throughout your pregnancy. So every trimester, check your iron levels, because your demand increases as your baby grows and as your pregnancy moves on. So be very aware that you are so at risk if you're pregnant. So it's so worth checking it
Yeah.
so that it can be corrected in time for your baby before they're born, but also for you as a mom to stop complications that come from being low on iron or anemic during your pregnancy and with delivery. So postpartum hemorrhages, being fatigued afterwards, postnatal depression is increased if your iron levels are low.
Sure.
So really, we really encourage pregnant moms, please insist, advocate for yourself. And I think that's the message.
Yeah.
Advocate for yourself. Ask your gynae, ask your clinic, please check my iron levels. Please make sure that they're what they should be for my pregnancy.
And can you cross over from iron deficiency to anemia throughout the pregnancy? So at any point it could happen?
100%.
Okay,
Absolutely.
so it is important to constantly check in on this.
Yes, it is. Yeah,
okay.
very much so.
Sister, could we touch on iron infusions? Can you tell me a little bit more about this? Because this sounds like a good thing to even know about. Yeah.
So I think, again, it's important to remember that oral iron is first prize because it is easily tolerable and it works really well. But if you don't absorb oral iron well, or you're running out of time in your pregnancy, intravenous iron is an incredibly good solution because it bypasses the gut, so you're not relying on gut absorption. It works really quickly and it corrects levels very quickly. So it's a very good option if oral iron is not working, or, as I say, in your third trimester when you've kind of run out of time to take your oral iron, to make sure that those levels are back up and that your baby's got the iron that they need very quickly. So it's a really good option. They're safe. They need to be administered, obviously, in a good medical setting, and you need to use a good medical grade iron. So you need to make sure that you're being dosed correctly for your requirements.
I love that. And I love that you've come with solutions and also encouragement that, yes, advocate for yourself at the end of the day, regardless at what point you are in your pregnancy. You know your body, or you should get to know your body a little bit better. So, sister, thank you so much for coming through with that. We really do appreciate it. It is a Health Tuesday, and that is how we wrap up our conversation all around talking about pregnancy, anemia, and the